So I'm going to be talking about something that's very common. It's headaches. Many people have had it and many people struggle with it. So stick around and I hope that you learn something from today's discussion. All right, so headaches. There's so many types of headaches, but we're going to touch more on the common types of headaches today. And I'm going to help you distinguish which type of headache you may be having depending on the location. So the most common type of headache are tension headaches. So tension headaches, they tend to form like a band-like pain that surrounds the top of your head, side of your head, and even the back of your head. And these, they tend to last a couple minutes to several days. And now migraines are the second most common headaches. So with migraines, they tend to be more one-sided, and they tend to have sensitivity to light and or sound. And you can also have nausea or vomiting along with a migraine headache. And these, they tend to last several hours to a couple of days. Now the third type of headaches are cluster headaches. Now cluster headaches is distinguishable because they tend to happen behind the eye. So you have a painful eye that is running, teary, and you'll have a runny nose as well. And this pain tends to be severe, and this can last from couple minutes, to a couple hours. And the reason why they call cluster is because they come in clusters. So this can last a couple of days and then go away, and then come back again for a couple of days and then go away. And then the next type of headaches that I want to talk about are the sinus headaches, the sinus or allergy headaches. And this is usually caused by an inflammation or an infection of the sinus cavity. So when this occurs, what happens is that there's with the air-filled cavities, there's actually fluid that fills it up. So that's why you get that stuffing feeling, that pressure feeling, and you even can have that to cause you pain along your sinuses. And then this obviously is resolved once the infection goes away or the allergen is taken care of. So the next headache is hypertension headaches. So hypertension headaches occurs when you have an elevated blood pressure that has been prolonged, has been there for a while, or if your blood pressure happens to skyrocket, and that's going to cause you to have the hypertension headache. And what that feels like, it's more pulsating. So it's pulsating on the top of the head and on the sides of the head. And usually, if you take care of your blood pressure, if you are able to maintain it, able to control it, the headaches will go away. And then the last set of headaches that I'm going to talk about are temporomandibular joint dysfunction headaches, or TMJ, where it's commonly known as TMJ. So with TMJ headaches, what happens is that the temporomandibular joint it's not moving properly, so it's not aligned properly. So what that does is it causes irritation to the joint in the temporomandibular region, and that's going to cause you to have headaches that tend to be on the sides of your head. And this is easily confused with tension headaches and often mistaken for it. So to help distinguish it from it is if you have clicking or popping while you are eating or chewing, that can be an indication that it's a TMJ dysfunction. Or if you're having pain while you're chewing, or if you just have a misaligned jaw, that's going to be indicative of a TMJ disorder. So when it comes to causes of headaches, again, there are so many different causes. There's can be multitude of things that causes headaches, or there could just be one thing that causes. So some of these causes can include stress. Stress is actually one of the top causes of headaches. And then you can also have a lack of sleep, dehydration, alcohol consumption, certain types of food, poor posture, hormonal changes, environmental changes, and or teeth grinding. Now again, this is just a list of the more common causes of headaches. There is a lot more that I won't be able to cover. All right, so with treatment or self-treatment to alleviate headaches, you want to do the reversal of what's causing your headaches. So if you're dehydrated, make sure you're drinking plenty of fluid. If you're lacking sleep, make sure you have adequate sleep. If you have poor posture, make sure you're practicing good ergonomics, and not just while you're sitting at work, but while you're walking, while you're sleeping. Just try to make it a good habit. And if your headaches are being triggered by food, find out which food it is and try to limit it. Try to limit eating it. And also you want to try to avoid processed food. Processed food tends to give you more headaches. And then also other things you can do is use warm or cold compresses on the back of your head, on the sides of your head. And you can also massage the muscles in the neck area, the temples, the forehead. And you can also practice meditation and practice yoga to help relieve stress. Now, these are just some of the self-treatments that you can do at home. Obviously, there's a lot more to it than just what I listed. And now next, what I'm going to show you is just some stretches to help with tension headaches. Tension headaches, as I said, is one of the most common headaches. So I'd like to just show a couple stretches you can do to help relieve some of that tension along the back of your neck. So the stretches that you want to do, the first one is just a pulling neck stretch. So what you want to do is you want to tuck your chin in like this, and you can grab the back of your head. I'm just going to pull down for 20 seconds, and you're going to relax. And then you're going to also you're going to want to do from the side, going to the sides as well. So you're going to turn your head, pull down, and you feel the pull on this side. Again, 20 seconds, and then you're going to switch side, pull down for 20 seconds again. So that's the first exercise you want to do. The next exercise is, I call it a neck pinching exercise, and I'll show you how it works. But basically what you want to do is use your 3 fingers and grab the back of your neck like this. Make sure you're sitting tall as well too. So you're going to grab on top, right below the base of your head, okay? Right in the occiput area. So you're going to grab it, pinch it, and then you're going to flex forward. You come back up, go a bit lower, flex forward, come back up, and you're just going to work all the way down your neck. And then come back up. Now this you can do up and down 3 or 4 times, and that should help stretch a lot of that tight muscles out. This is one of my favorite stretches to do when I'm having neck tension. So give that a go. And now the third one is just a chin tuck. So Chin tuck is for your suboccipital muscles. Suboccipital muscles are the muscles that are along the base of your head, and they tend to get tight with tension headaches. And I'm sorry, they tend to get tight, which causes tension headache. Because when they get tight, they put compression onto those nerves, and that's where you tend to have those headaches that expand around your head. So chin tuck, you're just gonna tuck your chin in, and then you're just gonna hold it for a couple seconds and release. Hold it a couple seconds and release. And this, you're just holding it for about maybe 3 seconds, and do this about 10 times and 3 sets of this. From the side, this is how it looks like. Chin tuck, relax. And it's just a very small movement. And those are the exercises that should help a lot with your headaches. So thank you for watching. If you like the content and if you enjoyed the information that I've given you here, please like, subscribe, and share my channel. I appreciate it. And until I see you guys again, take care.